So, good afternoon, everybody. Let's go. Something about evolution in the medicine. I'm surgeon, and 20 years ago, I was about that it's enough to cut people half, and that's my business. Unfortunately, I see that even we are many surgeons in Czech Republic, it's not enough to cut all the people they need it. This is evolution of Homo bohemians. It's probably most of you guys, sorry to tell the truth. Once you're born or till 20, you do sports, you're moving somehow. Then in 40, you give up these things. In 60, you dead. To be precise, it's 62 in Czech Republic. Health span is ending in 62. And then you're dying, 18 years to keep 80, which is approximate age amongst all EU. Looking these figures, you see where we are. If there is other people from other nations, other states, you can find out where you are. But we are really in Czech Republic 62 in the terms of healthy life years. So this is probably not the will of us, I mean of the community here, 11 plus minus million people. And it's also not my wish as a medical doctor, as a surgeon, to see people starving by mental or physical or combination hell, 18 years till they die. What's different between us and between women from Bulgaria? What's the difference between men from Malta? There is a 70, and Czech man, 62. That's the big question, and for me personally, even if I'm surgeon, I'm curious, and I'm trying to find out some better way, if not for me, if not for generation of my parents, so definitely some way for my kids. I'm father of 4. To be society or community which is quite rich, developing, and so on, it's based not only on how much big budget you have, but it's also, or maybe mostly about how healthy you are. If the production in Czech Republic ends in 65, and we are ill in 62, makes no sense to think that we are on the perspective way. And I'm not even talking about senior people, about people after 65. They are just waiting till death is coming. They are not moving like people from Northern Europe to see post-productive time, some piece of the globe, reading what they always want to read, enjoying community life, whatever. They are sitting home in front of TV sets and maybe looking on these people from the north, for example. The population, or strongest part of population, is moving to the senior age. That's exactly my age, the strongest. We are from 70s. In 2034, we will be 6.5 million people, almost on the edge of productive time. Once you grow up, most of you are quite young, there will be 1 working person to 2 people retired. I shouldn't be genius. I shouldn't be somebody who is saying in academia something about the economy to see that something is wrong, something is going not well. This is the budget of, or expenditure of Czech health system, Czech health insurance houses, covering such a big amount of money, and just comparing 214 with 224, it's a double price. But nothing is going double velocity. We are not double medical personnel in the system. Waiting rooms, they are not, or till you reach your doctor is not shorter 2 times. Everything is just 2 times more expensive, and the system is collapsing now. 2004, 2025, if we are just following this direction, it's about unsustainability of the system. People will rather go to Donio to ask for the treatment of their kids, because it's going to be sometimes not covered by insurance houses already. The miracle or secret thing I would love to tell you today, that your health span doesn't depend on healthcare system. It's just 10%. According to the papers, the most important is your brain, how you treat yourself. It's about 35%. So it's your decision to keep you on the trajectory of somebody who is healthy more than the rest of the population. Then it's about 22% about genetics. We are unfortunately also not working so much in the healthcare system in Czech Republic with the genetics. Then depends where are you from. If you are from Prague, Ostrava, Brno or main city, probably you will have a good salary. If you are living countryside, somewhere in the mountains, you can even think about genius food, whatever, but you have no money to buy. So even if you have a high level of your knowledge, how to treat yourself, you have no money. It's about social scissors in the community. Again, just 10% is a healthcare system. But you spend in Czech Republic 500 million Czech crowns. It's a huge amount of money wasted in the terms to prolong our health span, not life expectancy. We are quite good to keep this life expectancy towards 80, like the rest of the European Union. But back and forth, we are not caring so much about the health span. Do you know what is the most important thing if you are looking on how you treat yourself? It's the community where you live. It's your relationships. If we are just trying to see, and this data, they are from our think tank, Minister of Health, saying in Czech Republic we are not too much talking to each other. We are not spending much time with the family, with the friends. Comparing people from Macedonia, Portuguese, Greece, Belgium, whatever, we are again on the middle. But again, according to scientific papers, the most you can do for yourself in the terms of mental health is to be part of community, of your family, of your friends. You are able to talk with your boss, with anybody. You will be never done, and you will be never great, but you should try, because you prolonging the health span of yourself. 4 years ago, after my 15 years in the Czech hospitals, I have also experience within Doctors Without Borders. I've seen just ill people, treating ill people. And I'm asking, where is the vision of Czech healthcare system? And there is basically no vision. So my personal vision started in the time when I realized that probably it's better to keep health span than rather cut the people half. We started the think tank 4 years ago, again call it Minister of Health, in 4 working groups. One is focused on prevention, one on digitalization, one is helping employees in the company. We have a 4.5 people employed in the corporation in Czech Republic. And the last not least, maybe this was the previous or first one, it's about the data. If you want to drive or to do something, you need to measure. Not many of us, and not even system, is measuring something. So these 4 things are able, in this diagram, moving us a bit towards more healthy life years. If it's going to be 5, which is our vision, or if it's going to be just 1, it's great. But we have to do something else than just treat the people. If not, doesn't matter. For me, this personally, this is a great job. I'm really happy to cut the people half. The question is if you would love to. Thank you very much.